for us. How are you going to do that today?
Minister.
Thank you, Mr. Ball.
Thank you very much indeed, and it's a pleasure to serve under your chairmanship. Firstly, I would like to congratulate the Honourable Member for East Worthing and Shoreham on bringing forward this very important debate and the degree of consensus as to how important health visitors are to each and every family that they touch. The contributions I may not be able to answer directly, but I will ensure after this debate that I've written to those that there is further points to make in due course. I would like to pay tribute to his leadership and support for children and young people, particularly the efforts to focus on those first 1,001 days, which can impact on social, economic and physical outcomes throughout life. I strongly agree with the importance of early years intervention and how strengthening support at the very start can stop those problems escalating and help the broader family, as both he and the Honourable Member for Liverpool Wavertree pointed out. You can stop it before it starts, or certainly intervene. He made strong arguments around the value of health visitors and their ability to cross every threshold, which I don't think can be underestimated. Good health is one of our country's greatest assets, and we can't take it for granted. Just as we save for retirement, we should be investing in our health throughout life, from the cradle to the grave. Starting in childhood, actually before a child is even born, we can help ensure our children enter the world and are raised healthy and happy. Most babies do get a fantastic start in life. They benefit from the support of loving parents and dedicated health professionals. But we know that some lives can be easier than others. Often it's because of circumstances over which they have no control and the conditions in which they're brought up. Children who live in more deprived areas are more likely to be exposed to avoidable risks, have poorer outcomes by the time they start school. But actually, as the Honourable Member for Lady Wavertree pointed out, some of these things impact further down the line. A teacher at the weekend said to me, a child with poor linguistic skills, actually it impacts on their ability to learn to read because of phonics and so on. It's right, therefore, that support has a clear focus on reducing inequalities and targeting investment to meet higher needs. We remain absolutely committed to working with partners to identify how to support growth in the community workforce, including district nurses, general practice nursing, GPs, health visitors, school nursing. That team, as he so well laid out. We're putting in place significant actions to boost the workforce, ranging from training more nurses and midwives, offering new routes into professions, enhancing reward and pay packages to make nursing more attractive, improve retention and encourage those that have left nursing to return. I know that there is still that post-qualification, but I don't pretend there aren't challenges, as articulated by many, and particularly around issues like CPD, which we are aware of and working on. We know that the number of health visitors employed by NHS organisations and reported through the electronic staff records shows a reduction. However, we also know it's not a complete picture of the health visitor workforce, who may be employed in social enterprises, private sector organisations and local government. And I would like to work with partners like the LGA and the Institute of Health Visiting to establish a much clearer picture, which is what they asked for in the Vision for the Future report. I think it was recommendation 12 and 13. And this will help move the debate forward. I'm pleased that Health Education England is also leading on the development of specialist community public health nursing standard, a standard that would cover several roles, including the health visitor, school nurse, occupational health nurse and family health nurse. And I'm keen for things to move swiftly. Currently, a specialist community and public health nurse apprenticeship, level 7's in development, as the Honourable Member said. This will offer an alternative route directly into health visiting profession on top of existing pathways, which enable people to qualify as a health visitor. We must make the best use of these highly skilled and valued members of the profession and of the broader healthcare family, and ensure that they can optimise the good that they can do when they intervene in children's lives. Local authorities do remain well placed to commission health visiting and early years support, but in partnership, I would argue, with all those around. Of course I will.
So like many other members, I've been contacted by some terrific health visitors from Woking, and they do a wonderful job, but they do so against a very difficult financial backdrop. So as the Minister looks to resource this area in the future, can we make sure that there is fair funding across the country, including to our counties.
I thank the honourable member for his intervention. That links to the point that fragmentation remains a challenge throughout the system, running counter to the aims of that whole family support that the honourable member has stated. I believe strongly that there's scope to improve collaboration between councils and NHS bodies to improve delivery, particularly on those important issues around breastfeeding, immunisation and the like. Digital healthcare programme is an area where we're helping to overcome barriers, securing national backing so that information between key professionals is shared properly, and that is particularly important in strengthening the links between primary care and health visitors. But there's further areas where I think we can work better together to support those with higher needs. I intend to reflect on the points made during the debate this afternoon and also work further on the Vision for the Future report. The commitment to grow the public health grant as part of the local government settlement underlines the commitment to protecting and improving the health of the population, but local leaders remain well placed to make decisions for their communities, and we do have this disparity across the piece, and we need to understand the data better. Local decisions should be made on robust assessments of local needs, supported by workforce plans. Research suggests there are long and short-term educational, socio-emotional benefits of early childhood education and care, and the prioritised investment in early education, 15 hours free early education for disadvantaged 2-year-olds, is welcome. But I believe the benefits start earlier, your interaction with your health visitor at 28 weeks, or even before that in PHE lessons at school, where we talk about healthy relationships and equip our young people with advice on issues such as substance abuse and parenting. In the Prevention Green Paper, we announced our commitment to modernise the Healthy Child programme, reflected in the latest evidence on how health visitors are part of that wider integrated workforce, providing support. This work provides an important opportunity to work with partners, and I would like to take him up on his offer in his recent letter to bring with him academics and other interested parties, and I note the ones from across the chamber, to come and talk about how we can best move this forward. I want to ensure support is universal in reach, but capable of that personalised response, focusing support where the additional needs say we need to put them. I understand the continued focus on 5 mandated contracts, and which provide a vital opportunity for contacts with families. And national data does show that coverage has improved, but I do take on board the points. So I don't want to reduce those 5 moments, and I do think there is some interesting conversations around the other points of contact that have been mentioned. I have heard calls from health visiting professions that they're being pushed to tick the box but miss the point, and I've spoken to my own local health visitor lead on this issue. They are highly qualified professionals. They are really important in the leadership role, and it is a role I wish to reinvigorate. By working closely with commissioners, other professionals, particularly midwives, they are critical to a child's journey. If we're serious about supporting early intervention, then it means starting with relationships. Becoming a parent's important. It doesn't come with a manual. We all need help, and professionals provide an opportunity to give evidence-based advice and support. Our vision for prevention encompasses the whole life. We're now reviewing the Prevention Green Paper, including his response, which I know PIF submitted to the paper, and to ask ourselves the question and to work on what more can be done with local authorities and NHS bodies. In conclusion, to give every child the best possible start in life to fulfil their potential, we need to fundamentally change the way we operate. I want to ensure that systems are in place to help infants as they develop, move to school, grow into adulthood, overcome fragmented service provision and making the best of what exists, and then using evidence to make a resolute focus on those additional needs. I look forward to working with the honourable gentleman, and I am optimistic that we can make the change.
Order. I really apologise to right honourable members, but time has beaten us.